Welcome to Today in Psychology, your destination for all things psychological. In this video series, we're taking a unique approach to learning about psychology by breaking down important definitions and concepts, one letter at a time. Each video will cover a different letter of the alphabet and explore the key psychological terms and definitions that start with that letter.
From A for abnormal psychology to Z for zygote.
We'll cover a wide range of topics and provide you with the knowledge you need to succeed in your studies of psychology and related fields. But this series isn't just for students, it's also for anyone who's interested in understanding the inner workings of the human mind. Whether you're a parent, teacher, or simply a curious mind, these videos will provide you with a better understanding of the fascinating world of psychology. So join us on this journey as we explore the alphabet of psychology, one letter at a time, and gain a deeper understanding of the human mind and behavior. Don't forget to subscribe to Today in Psychology and hit the notification bell so you never miss a video.
And, if you are ready, let's dive into the world of cognitive behavioral therapy together. Welcome, everyone. I am thrilled to have you all here for today's installment of Today in Psychology. As many of you may know, in our previous videos of the ABCs of Psychology series, we have explored the fascinating world of abnormal psychology and behaviorism. These videos have provided a wealth of knowledge, and today we address the topic of cognitive behavioral therapy. If you missed one of our episodes, we strongly encourage you to watch our previous videos as well, as they will provide a solid foundation for today's topic, and will help you to fully appreciate the depth and breadth of cognitive behavioral therapy. Trust me, you don't want to miss out on this opportunity to expand your knowledge and understanding of psychology through this series. So, sit back, get your pad and pen, and relax. What is cognitive behavioral therapy? Cognitive behavioral therapy is a powerful tool that can be used to understand and modify behavior. What is cognitive behavioral therapy? Cognitive behavioral therapy is a powerful tool that can be used to understand and modify behavior. By the end of this video, you will not only have a comprehensive understanding of the key principles and techniques of CBT, but also its practical applications in the treatment of various mental health conditions. CBT has been found to be effective in treating a wide range of mental health conditions such as depression, anxiety, and PTSD. It has also been used to help individuals with chronic pain and substance abuse. With its clear structure and focus on the present, CBT is considered to be one of the most evidence-based forms of psychotherapy and is widely used by mental health professionals around the world. There are 6 basic key principles of cognitive behavioral therapy, CBT, which include the cognitive model. This principle suggests that our thoughts, emotions, and behaviors are interconnected, and that negative thoughts can lead to negative emotions and behaviors. Identifying and challenging negative thoughts. CBT encourages individuals to identify and challenge negative thoughts and beliefs that may be contributing to their emotional distress. Learning new ways to think and behave. CBT aims to teach individuals new ways of thinking and behaving in order to improve their emotional and physical well-being. Focus on the present. CBT is a present-focused therapy, which means that it aims to address current problems and symptoms, rather than exploring past experiences. Collaborative and goal-oriented. CBT is a collaborative therapy in which the therapist and patient work together to set and achieve specific goals. Emphasis on self-help. CBT encourages individuals to take an active role in their own recovery by learning new skills and strategies for managing their thoughts and emotions. Key figures in cognitive behavioral therapy. Today, we will look at 3 key figures that have influenced the study of CBT. One of the most notable figures in this field is Aaron Beck. Beck is often referred to as the father of cognitive therapy due to his pioneering work in developing the cognitive model of depression. He proposed that negative thoughts, schemas and assumptions, which he called automatic thoughts, play a crucial role in the development and maintenance of depression. Beck developed a therapy called cognitive therapy, which aimed to help individuals identify and challenge these negative thoughts and beliefs, and replace them with more positive and adaptive ones. His work has been instrumental in the development of CBT, and it has been found to be effective in the treatment of a wide range of mental health conditions such as depression, anxiety, and PTSD. In addition to his work on cognitive therapy, Beck also made important contributions to the understanding and treatment of other mental health conditions, such as anxiety disorders, schizophrenia, and substance abuse. He also developed a number of assessment tools, such as the Beck Depression Inventory, BDI, and the Beck Scale for Suicide Ideation, BSSI. And, these models are widely used in clinical practice and research today. Beck has received numerous awards and honors for his contributions to the field of psychology, including the Lifetime Achievement Award from the American Psychological Association. He is also a prolific author and has written many books and articles on cognitive therapy, depression, and other mental health topics. Beck's work continues to be widely studied and applied in the field of psychology, and he remains an influential figure in the development of CBT. Albert Ellis was another key figure in the field of cognitive behavioral therapy, CBT. He is best known for developing a therapy called Rational Emotive Behavior Therapy, REBT. REBT is based on the idea that our emotional and behavioral responses are largely determined by our beliefs, attitudes, and assumptions about events. Ellis proposed that irrational beliefs, such as demanding perfection, or the belief that one must be liked by everyone, can lead to negative emotions, such as anxiety or depression. REBT aims to help individuals identify and challenge these irrational beliefs and replace them with more rational and realistic ones. Ellis' work has been influential in the development of CBT, and it has been found to be effective in the treatment of a wide range of mental health conditions such as depression, anxiety, and PTSD. He was a prolific author and wrote over 80 books and 600 articles on the topic of REBT. He also founded the Albert Ellis Institute, which continues to train therapists in the use of REBT and to conduct research on the approach. He received numerous awards and honors for his contributions to the field of psychology, including the Lifetime Achievement Award from the American Psychological Association. Ellis' work continues to be widely studied and applied in the field of psychology, and he remains an influential figure in the development of CBT. An example of REBT in action would be a person who has the irrational belief that they must be perfect in order to be happy and loved. This belief may cause them to experience anxiety and depression because they are constantly striving for perfection and beating themselves up when they inevitably make mistakes. In REBT, the therapist would work with the individual to help them identify and challenge this irrational belief. The therapist might ask questions like, is it really true that you need to be perfect in order to be happy and loved? Or what are the negative consequences of believing that you must be perfect? Through this process, the individual may begin to see that their belief is not only irrational, but also unhelpful. They might come to realize that it is more realistic and healthy to accept that no one is perfect and that making mistakes is a natural part of being human. The therapist would then help the individual replace this irrational belief with more rational and realistic thoughts, such as, it's okay to make mistakes, or, I am worthy of love and happiness even if I am not perfect. This process of identifying and challenging irrational beliefs, and replacing them with more rational and realistic ones, is a key aspect of REBT, and it aims to reduce negative emotions and improve overall well-being. Let's move on to the third key figure in the field of cognitive behavioral therapy, David Burns. David Burns is an American psychiatrist and author, best known for his work in developing cognitive behavioral therapy, CBT, specifically for the treatment of depression. He developed a therapy called cognitive therapy for depression, which aims to help individuals identify and challenge negative thoughts and beliefs, and replace them with more positive and adaptive ones. He wrote several books on the topic. The most well-known is Feeling Good, The New Mood Therapy, which became a bestseller, and has been translated into over 20 languages. Burns has also developed a number of assessment tools, such as the Burns Depression Checklist, BDC, and the Burns Anxiety Inventory, BAI, which are widely used in clinical practice and research. a case study in the field of cognitive behavioral therapy. Jane is a 35-year-old woman who has been experiencing symptoms of depression for the past 6 months. She reports feeling hopeless, helpless, and worthless, and has lost interest in activities she used to enjoy. She also reports having difficulty sleeping and has lost weight. During her initial assessment, Jane is found to be experiencing negative thoughts and beliefs, such as, "I am a failure," "I am unlovable," and "Nothing will ever change." She also has a tendency to catastrophize and to blame herself for things that go wrong. The therapist uses cognitive behavioral therapy, CBT, to help Jane identify and challenge these negative thoughts and beliefs. Together, the therapist and her works on identifying patterns in her negative thoughts and beliefs and how they relate to her feelings and behaviors. They also work on identifying the evidence for and against these thoughts, and teach Jane how to dispute and challenge them. The therapist also teaches Jane how to use positive self-talk, mindfulness, and other cognitive and behavioral techniques to manage her symptoms. They also work on identifying and engaging in activities that she used to enjoy, and setting realistic and achievable goals. Over the course of several weeks, Jane begins to notice an improvement in her mood and symptoms. She reports feeling less hopeless and helpless, and is able to engage in activities she used to enjoy. She also reports an improvement in her sleep and has gained weight. Jane continues to work with the therapist for several more weeks to maintain her progress and to continue to work on identifying and challenging negative thoughts and beliefs as they arise. By the end of her treatment, Jane reports a significant reduction in her symptoms of depression and an improvement in her overall well-being. This case study illustrates how CBT can be used to help individuals with depression identify and challenge negative thoughts and beliefs, and replace them with more positive and adaptive ones. It also illustrates the importance of using a combination of cognitive and behavioral techniques, and the importance of setting realistic and achievable goals. In conclusion, cognitive behavioral therapy, CBT, is an effective form of psychotherapy that has been widely used in the treatment of various mental health conditions such as depression, anxiety, and PTSD. The key figures of Aaron Beck, Albert Ellis, and David Burns have made significant contributions to the development and understanding of CBT. Through their work, we have come to understand the importance of identifying and challenging negative thoughts and beliefs, and replacing them with more positive and adaptive ones, in the treatment of mental health conditions. The case study provided here illustrates how CBT can be used to help individuals with depression identify and challenge negative thoughts and beliefs, and replace them with more positive and adaptive ones. It also illustrates the importance of using a combination of cognitive and behavioral techniques, and the importance of setting realistic and achievable goals. In conclusion, I would like to thank you all for watching our video on cognitive behavioral therapy and the key figures who have influenced this field. I hope you found it informative and engaging. The world of psychology is vast and complex, and it's my goal to make it as accessible and understandable as possible. I also encourage you to like and subscribe to our channel, as we have many more exciting videos in the ABCs of Psychology series. Next up, we will be exploring the letter D, which will stand for developmental psychology. Developmental psychology is an exciting field that explores how we grow and change throughout our lifetime. It's an area that affects us all, and I'm confident that it will be as enlightening and thought-provoking as our previous videos. Don't miss out on the opportunity to expand your knowledge and understanding of psychology. So, please like, subscribe, and stay tuned for our next installment in the ABCs of Psychology series. We look forward to having you back for more.